Hello, Adriana.
Hello.
Thank you so much for your time. I really appreciate you coming on and just being a part of the Women's Digital Health platform and talking to us about a really, really important topic.
Well, I love what you're doing, so it's an honor and a pleasure to be here.
Yes, thank you so much. You are an Emmy Award journalist, you are a mom, you are a professor, you are an advocate for women's health. I'm already kind of like, how is she doing all of these things? But I get it. You got to do what you got to do.
Gotta do what you gotta do. And
Mm-hmm.
honestly, I don't know how it gets done. It just gets done. I was at a panel today for the DC Mayor's Maternal and Infant Health Summit, and they asked a question about work-life balance, and I was like, yeah, I don't have any answers. I don't know.
I get it.
So, yeah, when somebody cracks that code, please let me know. But I'm not the one, at least not today.
Get it. I get it. We're here to talk about like a really important topic that you have advocated so much for and really has educated me about a lot of the new opportunities that is facing Black women, including a lot of research opportunities that I wasn't even aware of. We're going to get into that. We're going to talk about all of the initiatives that you've been advocating for. But first, I want to start at the beginning. I want to start at Adriana, the young girl who starting to learn about her body. And I want I want you to take me through like what that journey was like and tell me more about what that was like for you.
So I remember not much about learning about my body. I remember going to like sex ed class in school and everything. I remember it being very, very basic and knowing that, you come of age, you get your period, it's bleeding once a month, and that means that you're ready to have children, et cetera, et cetera. I kind of remember being a late bloomer in that regard and getting my period late. And I remember when I got it, I mean, it was like cramping and a lot of blood, and nobody really explained that it was terrible.
Right.
Um, and I just don't remember much more beyond that. I
Okay.
feel like, obviously, having had to go through IVF, now I'm learning about fallopian tubes and ovaries and the uterus and the cervix and embryos and, all of the things that happen when a sperm actually meets an egg in a blastocyst phase. You know what I mean? That's when I'm getting into the nitty gritty. But I do not recall any of that in sex ed growing up.
What do you wish you would have known? I mean, even at that moment.
So I wish that, it would have been less sex education and
Mhm.
more, like anatomy class and physiology class, or however the body works class.
Right.
Um, and I wish it was more of a, this is what you can expect. This is how things should work. In other words, you should only bleed for 3 days and a couple of tablespoons a day or what have you. You shouldn't have these painful cramps. I wish it was more of, this is what to expect, and this is when you should go to the doctor and pursue more answers when things aren't the normal way.
Right.
That's what I would have wished. I feel like that would have saved me a lot of time and, researching on Dr. Google and trying to figure out what's going on.
Absolutely. So take me to the point at which you, in hindsight, started to notice that things were different, or if you even noticed that they were different.
So I don't think I noticed, just because I remember, when I was in high school and I got my period, I remember my mom was like, okay, I know it's painful. My period is painful. I get back cramps. You have them take Motrin or Excedrin the day before you're going to get your period so that you can try to alleviate the pain before it comes. Um, my mom bled for more than 3 days. I bled for more than 3 days. I'd, bleed for 7 days, and it'd be a heavy, heavy period. I didn't realize what a gynecologist meant by heavy. You
Right.
know, that was my heavy was a completely different heavy. Um, and so I don't think I knew anything was wrong really until I was diagnosed with fibroids. And even then, I don't think that anyone really explained, like, okay, this is what the quality of life should be for those couple of days a month versus what you're actually going through. I don't think I realized that, like, okay, my period is out of control, my
Yeah.
back pain is out of control until, like after I had my fibroids removed. And now I'm linking up with all of these advocacy groups. And I'm like, oh, had someone told me that, what, 20 some odd years ago,
Right.
you could have saved me the trouble.
Absolutely.
So, I
So
mean,
I guess the questions, you know, that kind of I'm thinking as a physician trying to take in this information is what are the best ways to help people talk about what a normal period is like versus a normal period? What terms do you wish you would have had so that the gynecologist would say, "Oh, wait a minute, we need to have a different conversation."
yeah. So I definitely feel like, again, it kind of goes back to this anatomy slash sex education class. I feel like
Okay,
if you just gave me a PowerPoint presentation
sure,
of this, and this versus that, and that would have been helpful. I feel like nowadays, and through my advocacy work, I talk a lot to doctors, gynecologists, OBGYNs, just about what are the questions that you want your patient to ask and what is the
right,
information that you want to be told, and then what questions do you ask. And I don't know that I ever remember anyone asking me, how long is your period,
okay,
and how heavy is your period, how often are you changing pads or tampons, are you bleeding through pads and tampons, you know what is your pain level when you're on your period. I don't think I ever really had anyone asking those questions. And I think those are the questions to ask. Maybe some doctors assume that the patient would know, like, bleeding for
right,
7 days and then spotting for 3 more days is not normal.
right.
I didn't know that though. So
Mhm.
unless someone pointed it out and asked me that pointed question, I was going to the gynecologist for years, like, oh yeah, everything's good. Get a pap smear, go home. You know what I mean? It's just
Yeah.
I just never knew. What you don't know can hurt you.
That's so interesting because I think in the more recent times, we've become very comfortable talking about periods and talking about, dissecting a period based upon the days and the amount of bleeding. But I don't know about you, but that was not my experience. And so I'm just wondering if what advice you could offer people about addressing the shame around talking about periods and maybe
Yeah.
some tips that people could use when they go to talk about this really important topic with their gynecologist.
Yeah. So, for me, and I joke about this a lot when I'm moderating panels and hosting events, in a way, you need to look at your doctor, whoever that doctor is like your hairstylist.
Yes.
And what would you stand for? Would you stand for a botched haircut or a bad experience or feel
Hmm.
like you're being overcharged for poor service? Absolutely not. When you go
Yeah.
to the hairstylist, like, are you all talking? I talk to my hairstylist. She knows about my life. I know about her life. We're giving each other advice. It should be a collaborative relationship between you and your doctor, any doctor. I don't care if it's an oncologist or an obstetrician.
Hmm.
It needs to be a collaborative relationship where you can say, I'm going to give you the nitty gritty. And I think patients need to realize an experienced doctor has heard it all and is going to take a lot to shock that person.
Hmm.
If that person is shocked, you need to find a new doctor.
Right.
If you go to a hairstylist and say, I want, a balayage, and they're like, uh-huh,
Right.
you would leave.
Hmm.
You know what I mean? So you need to
Hmm.
have those same standards for your doctor.
Right.
If you get a bad haircut, if you have a bad experience with a doctor, if they have bad bedside manner, if you're not getting the information that you want, if you're asking questions and they don't have it and they're not willing to give you information for a colleague or someone who might know the answer to your question, those are all just warning signs and red flags. But I think for a patient, when you're advocating for yourself, if you want, let me put it this way, you get what you put in.
Yeah.
So if you want a thorough exam, a thorough diagnosis, then you're going to have to be thorough in what your issues and concerns are. Otherwise, how would anybody help you?
That's a really important point. I think a lot of times we don't even have the network of people to know how to ask those questions, which is why I was so like in awe of what the White Dress Project is doing, because it's really creating the community behind how to talk to your doctor and how to not be ashamed of talking about these things. Um, we're going to talk a lot about the White Dress Project. I do want to actually talk about your fertility journey, because we've talked about young Adrianna, we've talked about Adrianna's conversations with the gynecologist before she gets pregnant, but now I'm like, okay, so now you're married, you want to start a family. Take me through, where is that? What is that conversation looking like now?
So I definitely feel like I probably didn't have any conversations really with an OBGYN other than like, yeah, I want to get pregnant. That's it.
Yeah.
There were no, prior exams or transvaginal ultrasounds or anything to like really get in there and take a look and see, okay, can you have kids? What happened was, I want to say it was May of 2016.
Mm-hmm.
I went to get just, the routine pap smear, and I laid down on my back on the table, and the doctor immediately just looked at me and eyeballed it and was like, your uterus is enlarged. I don't know what that means. And I'm like, okay. I noticed my stomach, my lower abdomen was getting big, but I hit 30. My metabolism, maybe it slowed down. I'm doing crunches and working out, thinking maybe I'm
Yeah.
just getting fat. She's like, no, your uterus is enlarged. And I'm looking at your chart, and there were no notes of this a year ago. So you need to
Okay.
go get an ultrasound. And so I got the ultrasound, and it was like, you have 3 fibroids. What are fibroids? Well, they're benign tumors and blah, blah, blah. And at this point, I'm like, okay, how will this affect my fertility?
Yeah.
And so, I went back up to the doctor, and again, it was this, well, you have 3 fibroids, but it's not really affecting your quality of life. And unbeknownst to me, yeah, I'm bleeding during my periods for 7 days, spotting for 3 days or 4 days after that. It's extremely heavy periods. I'm having back pain. That quality of life was normal for me.
Right.
So I guess for her, it was like, well, just leave them. It's not really affecting your quality of life. But I wasn't conveying to her, like, what I'm experiencing isn't normal, for her to tell me, okay, it is affecting your quality of life. So that doctor said, just leave them. And I called my mom, who's an anesthesiologist, and she said, you need to contact a fertility doctor who is concerned about your fertility.
Right.
And so that's when it was just kind of like, okay, I want to have kids. I want to have kids between this age and this age. At the time I was engaged, I was like, we're going to start a family soon. So you need to get in there and figure out what's going on. And that doctor did. And she said, you don't leave fibroids,
Right.
even though my fibroids were not in areas that would affect my ability to get pregnant. In other words, an embryo could implant in my uterus, and there was nothing blocking sperm going through the cervix. She was just like, you don't leave fibroids. What if you do get pregnant? Now your
Right.
body's got to choose to give blood to the baby or the fibroid.
Mm-hmm.
If the baby gets the blood, that fibroid's going to die. Now we're going to do surgery on a pregnant woman in her
Right.
uterus with the
Right.
baby.
Mm-hmm.
Or your body chooses a fibroid to give
Right.
blood, and now you're putting your baby's life in jeopardy.
Mm-hmm.
So she was like, you take them out, period, point blank. So that was probably the point when it was like, okay, now I'm laser focused on my fertility. And so I had the myomectomy surgery. The doctor pulled out 10 fibroids at that time. And then it was a matter of, okay, I pulled out your uterus, your fallopian tubes, I pulled out everything, looked at everything. Everything looks great. You should have no problem getting pregnant. So cool, we're happy. Um, get married, start trying to have a kid. It's
Mm-hmm.
not working. We've gone past however many, 32 years old, what have you. Maybe you try for 6 months. I don't know what the numbers
Right.
are
Mm-hmm.
or the timeline is, but we went past it. And
Mm-hmm.
so my OBGYN was like, let's go ahead and get some blood drawn. Let's get some numbers and see what's what. Everything came back normal. And so it was like, well, it's called unexplained infertility.
Right.
So we didn't have a reason as to why it wasn't happening for us. I don't know if the fibroids had anything to do with it, or, maybe my body was just like, yeah, I'm not interested in this right now.
Right.
But my fertility journey didn't start until that fibroid diagnosis.
Got
That
it.
was really the first time. It was like, up until then, I'm thinking, pregnancy is easy. You
Yeah.
get pregnant, boom. I didn't even know. I mean, I'm telling you, I knew nothing of ovulation, tracking your ovulation. I knew nothing of that. Um, and again, that goes back to like sex education
Yeah.
slash anatomy class. No one, it didn't dawn on me. I was unaware.
You talked about that it was like you were laser focused when the fertility journey, when you really were saying, hey, listen, this is a goal. I want to start my family. What do you wish you would have known before that in terms of the health literacy conversations you were having just before, you were having conversations with your gynecologist about starting a family?
So, you know, that's a good question. I guess what I don't know is what I don't know. In
Sure.
hindsight, what I say now is I think that um, insurance companies have changed their policies on pap smears. And I want to say the last time I checked, it was like, every 5 years, get a pap smear. And then when you're 40 or 42 or 45, then you can go to every 2 years or 1 year or something. I think that's just all absolutely ridiculous and does a disservice to women's health.
Okay.
In hindsight, what I wish is that um, at key ages or key moments in life, i.e., when you start to get serious with someone and you can see a future with this person where you want to have children with this person, I feel like you need to be getting ultrasounds,
Okay.
MRIs, all of the things to figure out what is happening with your body now, so that down the line, you're not freaked out when it's just not happening naturally.
Right.
And whatever might be happening, maybe there's a fallopian tube that's blocked, or maybe you have fibroids or endometriosis or PCOS. There could be a million reasons why your fertility journey might be difficult. Figure that out early.
Right.
You know what I mean? Like, and so maybe the magic number is when you get your period. We're going to do a whole ultrasound and do a checkup and see what's going on, because that's going to be our baseline. And then in 5 years, we're going to go back and see, has anything changed? What are your periods like now? What are your cramps like now? Etc. And then maybe in another 5 years you do this, or maybe every 3 years you do it, or it's like, oh, okay, you're looking to have children in the next 2 or 3 years. For these next 2 or 3 years, we're going to be doing these ultrasounds once a year when you come in for your pap smear. I just feel like for a lot of women, because we've been so trained to think that it's going to be a natural thing, an easy thing, any random day of the month, it could happen. We just don't ever think about there could be something going on, and that's why it's not happening. Again, on the panel today that I was on, there was a woman there who said that she kind of always in the back of her mind knew that there was something going on that was a little
Yeah.
funky with her body, but when she tried to have kids, it wasn't working.
Right.
Now she goes to the doctor and it's like, oh yeah, you have PCOS. Okay, well, now that I'm ready for children, I've got to deal with this issue first, and that's
Right.
delaying the timeline. Whereas, had we known these things, 10 years ago, you could have saved yourself the trouble.
So true. I also remember you telling me about a lot of legislation that has been passed, and I did some research on this, and I was astounded by the numbers that I saw with respect to uterine fibroids research. The Stephanie Tubbs Jones Uterine Fibroid Research Project, that is the Education Act, has gotten some funding, but it appears as if we're just now starting to offer the funding compared to other initiatives
Yeah.
that support, you know, important topics like cystic fibrosis. The relative ratio of funding to uterine fibroids and other associated women's health projects are significantly underfunded.
Oh, yeah.
And so I'm thankful to the White Dress Project for really bringing some of these things to light. And quite frankly, I wasn't even aware that these things were happening, and nor did I have the understanding of what that might look like for someone as I get education as a physician and learn how to treat. But my question to you is, as we uncover the lack of research,
Mhm.
what are things that people can do to really bring awareness and talk to their doctor about their need to maybe get more education, maybe consider finding research dollars or things to really change the awareness around uterine fibroids?
So I feel like people have to talk about having fibroids, is like step one. When I was diagnosed, I had never heard of fibroids. I didn't know what it meant. You say tumor to me, I think cancer immediately.
Right.
I don't care if you have benign in front of the word. I'm just thinking this is a disaster. And then, later, when I'm talking to my surgeon who's doing the myomectomy, she's like, by the time Black women are 50 years old, 80% will have fibroids.
Right.
So it is a completely common thing. It's probably more rare to not have fibroids in your lifetime than it is to have fibroids. But when I was diagnosed, I felt so alone.
Right.
I, never heard of this. No one ever said anything. I'm thinking, why is this happening to me? The world is caving in on me. And it's like, yeah, this is pretty regular. And
Mm-hmm.
so we have to talk about it so that people don't feel isolated or alone or some sort of shame
Mm-hmm.
when they're having surgery on their uterus to remove fibroids. I think the other thing is, once you have that diagnosis, wherever you are on your journey, you have to link up with an organization that's advocating for awareness around uterine fibroids and research dollars. You have to link up with that because you never know, A, whose life you'll touch,
Right.
or B, how far those testimonies will go. Um, so though that's probably the two immediate things I think people can do. I think in terms of the medical profession on that
Mm-hmm.
side, I think doctors have to really speak up. Not just Black women doctors,
Right.
all doctors of all races and genders. You have to speak up and say, okay, this is something that I see all the time. And we've got to get to the bottom of it. When I do these panels that I moderate and these events that I host, there's always someone in the audience who says, where do fibroids come from? Why do they happen? And the experts always say, well, we don't know. It's never been researched. That is a problem. You can do the research, figure it out, and maybe we can prevent this on the
Right.
front end and eliminate this as a problem. I mean, it costs money to deal with this issue. You're buying more pads and tampons than you need to. You're buying more sheets when you bleed through at night. You're buying more clothes when you bleed through your clothes. It affects your relationships. It affects
Mm-hmm.
your sex life. It could cause issues with your fertility. Now you're out of pocket over IVF and IUI and birth control and treatments. It's a financial burden, it's an emotional burden, it's a social burden, it's an issue. So I think that the doctors have to start speaking up and advocating for research funding for uterine fibroids, and the people who are dealing with fibroids, wherever you are on your journey, you have to talk about it and link up with the group that is doing advocacy work to get this problem resolved.
You brought up a really good point about the consequences of not physicians not necessarily being aware of this challenge, particularly if there's not research dollars. And I did see some astounding statistics, particularly around the training for myomectomies versus laparoscopic assisted hysterectomies versus, robotic
Yep.
hysterectomies, and that, there's a need for physicians to have this specific training to actually do the work. What would be your advice to people who are trying to make the decision on the type of care that they want if they are seeking fertility versus considering a hysterectomy?
So I think that, and this is where the White Dress Project just really excels. They're always having events that you can join virtually to talk
Mhm.
about different treatment options and options that might not come up when you get on Google, and when you have these doctors and experts giving this information for free,
Mhm.
you're not paying a copay for it, it's for free, you'll find out there might be multiple ways of treating fibroids at the same time. You might be able to do, a CESA or UAE and something else at the same time. That might be the best option for you. A major problem that's been going on for a really long time, and in some cases it still does, is women with fibroids would talk to their doctors, and the first thing, and really the only thing they would say, is hysterectomy.
Yeah,
Wherever you are in your life, during your childbearing years, it's like, well, hysterectomy. That's not the only option out there.
right.
So you have to link up with a group that has vetted information, that is offering expert advice from people who have true experience,
Mhm.
and you have to make an educated decision based on that. We talk a lot about getting more than one opinion. And in these sessions that we do, there was one doctor in particular, she said, you can get 2 or 3 opinions, that's fine. If you're getting 7, 8, or 9, you're looking for a doctor who you want to say what you want to hear.
Right.
So you need to find 2 or 3 opinions and go from there, but don't go searching and trying to find the right doctor to say what you want to hear. So I think patients really have to get as much information they can on the front end, and then visit a couple of doctors and see, is this something that you can do? Is this in your field of expertise? If not, can you direct me to somebody else?
Mhm.
If you don't think this is a good option for me, can you explain why?
Mhm.
And ask those questions. Again, it's your body, it's your money. Back to the hairstylist, it's your hair.
That's
You
right.
don't want to walk around looking crazy, and
Mhm.
you don't want to go to a doctor who's not performing the best procedure for you, and you're having complications down the road.
That's well said. I think that a lot of this is just a lot of times, patients don't have the information, so they don't know how to look. And so
Yeah.
I really like the White Dress Project's collaboration, with medical professionals that have that experience, but also having patients to advocate directly
Mhm.
for themselves to doctors and giving them the guide that they need. Um, and after that, so Adriana, I have some other questions about like digital health. We're a digital health company. We want to offer other health apps, any technology that you've used on your journey, whether it's for your mental health, for tracking your periods, or what other solutions could you suggest or recommend to people as walk through this journey?
So for me, one of the big apps was Clue, the period
Mm-hmm.
tracker app.
Mm-hmm.
That was helping me with my ovulation tracking, and also helping me because my periods have been irregular through the years. So, now that I was taking my fertility seriously, and after my fibroid diagnosis, whenever I would go to the gynecologist for a checkup or what have you, I would pull up the app, like, yes, my last day of my period was this day,
Yeah.
and, the next one was here, and I would actually have the information. I think probably prior to that, I was just, yeah, I think it was a couple of weeks ago, and yeah, it lasted, you know what I mean? Like, just kind of guessing. So Clue is a major app that I use. I don't, once I had my kids, I was using all of the Bump and
Yeah.
all of those apps and everything. I have not used a mental health app.
Okay.
Um, but I think that in this day and age where you have your phone, you have your iPad, you have your computer, anything that's at your fingertips is clutch.
Mm-hmm.
It just kind of is one of those things that makes it absolutely no excuse. Why don't you know when your period is? There's 8,000 apps for you to track your period.
Mm-hmm.
Download one and figure it out. So I think that, digital health and all of that, I think that's going to be really, really key in getting people to stay aware of what's going on with their bodies, to track what's going on with their bodies, and to relay that information to their doctors.
Awesome. So I have to ask, how is motherhood now? You have two beautiful children. Um, you're doing
Motherhood.
everything else. So
Yes, motherhood is a journey, and it's one of those things, good days and bad days, and that is just me being transparent. I think a
mhm.
lot of times, You look on social media and it's the highlight reel of people's lives.
Mhm.
But I was late to this interview because my kids would just not stop crying for no reason. My son's fighting sleep, even though he's exhausted. My daughter wants a sucker, even though she's already brushed her teeth. And those are the things that it's just like, oh my God, Um, the other part of it, and one of my friends from my yoga class just had a baby, and I had high risk pregnancies. I had a traumatic birth experience with my son. And so I try not to tell people too much of the bad stuff because I don't want anyone to go into their own journey with this in the back of their head. But she reached out to me maybe 2 weeks after having her baby, and she was like, nobody told me it would be like this. And I'm like,
Yeah.
like what? Good, bad? She's like, everything hurts. When he's breastfeeding, my uterus is shrinking and I can feel it contracting. Um, it's just a lot. And she stopped breastfeeding and she felt guilty over that. And I'm like, girl, please, like, is your child alive? Congratulations, you've made it
Mhm.
another day. And so when she said to me, no one told me it would be like this, I was like, this is why we have to do more talking out loud and saying the quiet parts out loud. Recovering from labor is difficult for some people.
Yes.
For those people who it's not, good for you,
Right.
bless your heart. Um, during my panel today, Tamar Braxton was on the panel and she said she did not connect with her son when he was born.
Yeah.
That happens. It happens. Postpartum depression is a thing. It should
Absolutely.
probably be expected more
Mhm.
than unexpected. Postpartum depression lasting for more than a couple of weeks, lasting months, lasting a year. Like, yeah, there is a whole fourth trimester that nobody talks about.
Mhm.
That
Mhm.
first period after you've not had a period for however many months, it's a
Right.
doozy.
It
You know
is.
what I mean? Like,
Yes.
no one says these things out loud. In spite of all that, is motherhood beautiful and wonderful? Absolutely. And I try to remember, what is that saying? The days are long, but the years are short, and time flies. My daughter's already 3, and I remember having her. I remember when she was born and laying on my chest. So time flies. And are there more good days and good feelings than bad? Absolutely. But I tell people all the time, not every day is rosy. It's not always unicorns and sunshine. It's just not. Sometimes it's a swamp, period.
Yes. I
You
totally relate. But I'm happy that, we talk about, you know, uterine fibroids and the challenges that are associated with it. Your journey in being able to develop the vocabulary and the relationships that you needed to support that, and now you have two beautiful children. Um, and so I think that this is a good example of how you can overcome some of these challenges with the right community, right? And White Dress Project does a great job of giving people that space to be like, listen, this is happening to me.
Yeah.
Um, my the flip side of this is those who have challenges still have challenges getting
Hmm.
pregnant, right?
Hmm.
Because that's real.
Hmm.
What things could do you offer? What things would you say or offer to that community that is still struggling to try to get pregnant, despite having some of the interventions that are offered?
Yeah, so that's a hard one, because I know those people and I know how much they want it. Um, and I'm not that person who's like, well, maybe it's just not for you. I'm not
Yeah,
that person at all.
yeah,
Because when I, had to start IVF, and I say this all the time, like, me and God had some arguments and I was pissed. And, people talk about a come to Jesus moment, like, yeah, we came to blows,
right.
and so I think all of those feelings are very real, and legitimate. And, um, I always say, like, when you're in the trenches of that diagnosis, when you're in the trenches of the treatment, um, you're gonna have to take the baby steps and the small wins and just keep moving forward. I believe in light at the end of the tunnel. I believe in the sunrise over the horizon.
Hmm.
And I believe that sometimes it can take a while to get there. Um, I think especially in the Black community, we all know that passage from Psalms, King David, yea, though I walk through the valley of the shadow of death, I shall fear no evil. And when you look at that passage, it's like his enemies are bearing down on him, and here's God with a table before him, and they've got to sit down and have a meal, and he anoints his head with oil, and it's like my enemies are right there. And it's one of those things that's very comforting because you're at a table with the Lord, but it's also like no one said in the Bible how long you're gonna be sitting there. Like, how long are we gonna be sitting here? And this is great, but, like, I still have this thing over my shoulder. And it's just one of those things that really resonated with me when I was going through my journey because I didn't know how long I was gonna be sitting there. I just knew that I was gonna be sitting there, and we'd be here for a while, and we'd be talking, and we'd be getting through this, and I'd be looking for the sunrise and looking for the light, and then it finally for me came. Um, so I firmly believe that you might be in the trenches, you might be at the table with the Lord for a while,
Hmm.
and you're just gonna have to sit.
Thank you so
But I
much for
do
that.
believe in a light. I do
Yeah.
believe in a light.
Adriana, what are some first steps people can take if they wanted to join the White Dress Project? If they wanted to know more about what you're
So it's
doing?
not even like a membership type thing. It's just one
Okay.
of those things where you follow them on Instagram at We Can Wear White. You go to their website, thewhitedressproject.org, and you find out what events are going on online, on social media. They have Instagram lives, they do things on YouTube. During the pandemic, it was all virtual, but here this past year, they had in person events in Atlanta, in Boston, in DC. And so there's always something going on. And so you don't have to join, there's no dues to be paid. I would just say figure out what is the next informational session, meaning a session about treatment for fibroids, or I've been diagnosed, what are my next steps, or advocating for myself, or ask the doctor. They have a whole series called Dialogue with the Doctor. So it's just a matter of tapping in and getting the information because it is free and it is good. And there's a lot of people who will take the information they get from these sessions and go back to their doctor and say, what about this, this, and that? And find out that doctor is not perform those procedures or they're not knowledgeable about those things. Well, now you know to find somebody else, so that's how you get connected with the White Dress Project.
Adriana, tell me other projects that you're working on. How can people find you?
So you can find me on Instagram, LinkedIn, Twitter, Facebook. It's Adrianna Hopkins, Adrianna with two N's. And I'm there. I'm trying to share my story as much as possible. I'm based in the DC area, so whenever there's a maternal health event going on or a women's health event going on, I'm typically there. But that's how you would reach out to me. And then in terms of finding information about fibroids, vetted information is key. Uh, I the White Dress Project did not exist when I had my diagnosis, to me, but I remember when I moved to this area, the founder of the White Dress Project, Tanika Gray Valbrun, she called and asked if I would host something. And I was like, girl, you have no idea. I am going through this right now. And so she was right on time. And so when you find that sisterhood and support system, you just have to tap into it. And
That's
they
awesome.
have vetted information. That's key. You're not going through the black hole of Google, and you're not, getting bad advice. You're getting vetted advice from doctors who have performed countless surgeries and procedures for fibroids.
That's wonderful. That is amazing, and I'm glad that we have this resource and we have initiatives like this that is changing the conversations about female fertility. So thank you
Mhm.
so much for being here. Thank you for your time. I look forward to hearing more about your adventures in motherhood.
Oh, God. Oh man, I put those on Instagram as well. So
Yes,
little crazy kids.
it's a lot of fun. It's a lot of fun. All right, I'm gonna end here.